The Upper West region is among the least infected regions in Ghana. That, however, could change, with health authorities in the region saying the case count in the area stands at 54, with 5 health workers being among 14 confirmed new cases. The Upper West Regional Director of Health Services, Dr. Damien Punguyure, at a program to mark the 60th anniversary of the Nurses and Midwives Association in WA said 4 of the health staff are nurses.
You are playing a very significant role in this fight. At the same time, you are faced with challenges. So we need to address them. Currently, the case count in the region is 54 with no death. There has been no severe illness. 40 of them have been discharged from treatment using the revised case management protocol. The rest are mild and do not need any severe treatment. They are being managed in isolation. Unfortunately, 5 health workers have been infected, and 4 of them are nurses. So the need to adhere to precautionary measures at our health facilities is very key.
The Upper West Regional Chairman of the Ghana Registered Nurses and Midwives Association, Lawrence Bagremin, decried the conditions under which their members work in the region and appealed to government to find a solution.
We have asked for PPEs, and we are given in many instances a single layer cloth mask, a pair of gloves, etc. to trace contacts with. This is unfair exposure. We don't know above all, we are divided by a certain red line called front line and probably a back line. We don't know the intention of government at this point in time, especially that we are told that these decisions are taken based on science. We are yet to understand whether this science is political science, social science, or health science. But to us as nurses and midwives, it simply doesn't add up.
Some nurses and midwives who spoke to Citi News said they are living in fears after the announcement that their colleagues have contracted the COVID-19 in the region.
We are pleading, they are doing their best, but their best should be improved. The necessary logistics should be provided, at least the education and all those things that need to be sent to the citizens for them to understand the magnitude of the infection, so that at least whatever the health worker is also providing at the health center or is even out in the community, telling them they should understand it, they should adhere to it, so that there won't be so much burden.
If a health staff is being contacted with this disease, he or she can easily transmit it to people more than any other person, because we have a number about 100 and above people visiting the health facilities every day. So if any of us had it and we did not know, and then we can easily spread it to the community. So I think government should come into our aid, bring more PPs as they are continuing doing. But I think they are doing much, but not enough for us to prevent, looking at the number of health staffs that are being affected with the disease.
Meanwhile, the Upper West Regional Secretary of the Ghana Registered Nurses and Midwives Association, Evans Ibn Samba, is calling on government to reconsider the guidelines constituting frontline health workers in the region.
We would want to maintain that it should not take COVID-19 to redefine who a frontliner is. If we look at the statistics available to us as of now, indicate that only just a handful of those who have tested positive for COVID-19 are traced to the treatment centers. So if you now decide to limit a frontline health staff to only those who work at the treatment centers, I think that we are missing the point hugely.